And Angel hasn't joined us from Gardner yet? Okay. So, welcome to week 13, is it? Or 12? Try to keep it in line with actually week 13. Week 13 is chapter 16 and 17, anesthesia and surgery. But we're going to start off the class by going over some of the E and M answers. Where did we leave off? Number. Do you remember what number?
Was it 38? Or is that just one I didn't know how to do?
It is question.
Yeah. Well, what I'm going to do is I'm going to have Emily start doing the answers for me while I go use the bathroom real quick, and I will be right back. Yes, for the workbook. Chapter 6 practical in the workbook. I'll have her start reading all the answers. And then as you get them wrong, remember I said don't cross them out, just right beside them the correct way. So I'll give you the answers. It's only the even numbers.
So you want me to go over the odd ones too?
Yep. So, just go in here and stand up. All right, so here's the workbook. Just start from the beginning for the practical. Okay. So, right here, and just make sure you choose ICD-9 codes.
Okay.
All right, just read them slow so everyone can hear you.
Okay.
And I'll be right back.
All right.
And then we can go over any questions that you have when I return from the bathroom.
Number 32, the CPT code would be 99217, and the ICD-9 codes would be B71.4 and E819.9. And for number 34, the CPT code is 99221, and the ICD-9 codes are 075 and 276.51. Number 36, the CPT code is 9214, and the ICD-9 codes are 696.1 and 719.40. And number 38 is CPT code is 99201, and the ICD-9 code would be 401.1. Number 40 is 99244. ICD-9 code is 338.21 and 724.2. Number 42 is 99252 for the CPT code and 482.40. Number 44 is 99242, and the code for ICD-9 would be 383.1. That's 44. And 45 would be 99231. The ICD-9 code is 307.81. 46 is 99251 for the CPT, and the ICD-9 code is 250.00. 47 is 99241, and the ICD-9 code is 553.01. Am I going too fast?
A little.
Sorry, I'm trying to figure
It's
out.
all right.
So 46 is 99251, and the ICD-9 code is 250.00. Number 47 is 99241 for the CPT code, and the ICD-9 would be 250.00. No, I'm reading the wrong one. I'm messing this all up now. I'm just reading the wrong answers and mixing them up. That one is actually 553.01 for the ICD-9 code.
Oh.
Sorry.
Good. I thought I was like way off.
No, I was reading the one before that for the answer. Sorry.
Welcome to my world.
Oh my goodness, I couldn't do it because I'm trying to read and look up at the same time. And it's not working.
I'm sure she did a great job, right, girls?
Yes, you did.
Okay. So what number were we on?
47, which I said the answer for 47.
Okay, so 47. You did that one?
Yeah.
48. 99254 with 480.1. 49. 99245 modifier 32 with a 722.73 diagnosis. Now, keep in mind that what we are coding is based on the category that was given at the beginning in bold. So that you had emergency services, nursing facility, domiciliary, and home services. So these are the type of E&M codes you should have had. 99285. Number 51, you should have had 99282 with diagnosis codes 81341, E917.0, E007.3. Did everyone get those or not?
I didn't.
Okay. Which ones did you get?
I messed up on the whole ICD-9 codes. I have my CPT code right.
Okay. So we'll go back to it afterwards. I want you to look at what you chose versus what the correct answers were.
Mm-hmm.
Number 52, 99318 with 290.0, 250.00, 401.9, 244.9, and 435.9. Number 53, 99342 with 782.3. 54, 99307 with 331.0 and 294.10. 55 should be 99309 with 298.9, 780.4, and 438.9. $56, 99334 with 70714 and 57, 99324. $58, we were coding for prolonged services and preventive medicine. 58, 99215. That's for the office visit. And then 99354 and 99355 times 2. That would be for the prolonged services. So your 99215 is for the first 40 minutes of the initial visit. And then your 354 and 355 are for the additional 10 minutes. $59, 99205 and 99354 and 99355, and then 60, 99396. Then moving on to 61, we would see services from throughout the E&M section. 61, you should have 99205. 62, 99202 with 462 for your diagnosis for pharyngitis. 63, 99234, and then your diagnoses would be 698.9, 786.05, and E935.9. The stumper on this one was the allergy to the medication, the allergic reaction to the medication. So you would have looked up in the table of drugs and chemicals under analgesics, and external cause, it would be therapeutic because it was an allergic reaction. So they took it the way it was supposed to be taken, but they had an allergic reaction. 64, 99238 with diagnoses 276.51 and 276.1. 65, 99251. 66, 99318 with 401.9 and 250.00. 67, 99291, and then 99292 times 3, and that would be based on the E&Ms, multiple E&Ms. The diagnoses, 518.81, 428.0, 491.21, and V46.11. Why? Because they were on a ventilator. Number 68, 99397, with a diagnosis of V70.0. Why? Because this was a checkup for this gentleman. He was in good health. On the reports, I think we did number 70 in class, didn't we?
Yeah, the discharge.
Yeah. So number 69, you should have had 99283. And your diagnoses, 646.63, 599.0, and 782.3. $70, 99239. Diagnoses, 198.89 for the primary, actually for the secondary malignant neoplasm of the pelvis. Then 199.1 for the primary malignant neoplasm. Then the third diagnosis, 459.2 for the vena cava syndrome. 996.74 for complications due to the catheter not elsewhere classified. And 401.9 for the hypertension. And then 338.3 for the pain due to the malignancy. Do I need to repeat any of those? 71, 99212 with diagnosis 845.00. 72, 99221 and 73, 99232. Okay, questions on those? Lisa Leonard, when you finally finish this chapter, if you have questions, we can set up a conference call or video chat.
That would be wonderful, thank you.
Okay? All right, well, we're going to move right into anesthesia. Woohoo! Anesthesia! Let's turn to page 489 in your textbook. And we're going to turn to anesthesia in your CPT book. Now, I had a student who didn't have anything better to do in her time but to re-tab my book for me. So, my book has been nicely re-tabbed and highlighted and noted, just like I tell you guys. I have to show you all. Let's see if you can see it. Does that help? Yeah, a lot of tabs. And so let's see if I can show you the highlighting, underlining. Yeah. Okay. So this is what, when I say to you underline or highlight in your book, this is what I'm talking about. Okay. All right. So turn to page 50 and 51. Now, basically, we're still pretty new in our CPT book, okay? But basically, everything that I am presenting and talking about is stuff that you will find right here in your CPT book, in your guidelines, in your categories, in your subcategories to highlight and underline. So I'll be teaching you a few tips and tricks along the way about bubbling and highlighting and stuff like that, so that the things stick out when you are looking up codes, okay? So the first thing that comes to mind is on page 50 and 51, we have some white space. Now you can use that white space on 50 for your E&M stuff. The white space on 51 at the bottom, you can use that white space, all right? But basically, what you see here on page 51 in green underneath those headings also have to do with guidelines that are brought forth into this section for you to remember when you're coding for anesthesia, okay? So that's what you want to keep in mind, is that you have guidelines at the front of every section, but also throughout the codes, you have guidelines being brought forth. All right, so keep that in mind, as well as coding tips, notes. It's not just in your ICD-9 book, but it's also in your CPT book. All right, so who is the anesthesiologist? The anesthesiologist is the doctor of medicine who specializes in anesthesia. All right, we see that right on page 490. Anesthesiologist, doctor of medicine who specializes in anesthesia. Now, usually the anesthesiologist is an independent practice, not a hospital employee. So right over here or at the top of anesthesia guidelines, or even underneath before the beginning of the paragraph, you might want to just make a note that usually independent practice, not employee.
And they're not cheap.
No, they are not. Okay, so something like Anesthesia Associates or Pain Clinic Limited. So what you want to keep in mind with anesthesia is that it is reported separately, okay? So in the second paragraph, I want to say probably the third sentence, these services include the usual pre- and post-operative visits, the anesthesia care during the procedure, the administration of fluids and or blood and usual monitoring services, example, ECG, temperature, blood pressure, oximetry, capnography, and mass spectrometry. Underline or highlight that. Now,
Where
some
do you want
people,
us to start?
in the second
The third?
paragraph,
Mm-hmm.
It would be the third sentence. These services include the usual preoperative. About middle.
God, I need a class on just how to do this. It's all zigzaggy.
I will try to go slow. You just have to stop me. Just remind me, hey, slow. Sometimes I forget because I've been teaching it for so long that it's automatic. If you can remember that whatever I am presenting, that is what you need to find in your guideline. That's what you need to find in the paragraphs. Because I'm reading what I put together based on what the book is, how the book is flowing. Okay, so it's not like you can't find it in your book. It's just follow along in your CPT book, not your textbook. I don't think you have in a while, right?
No, because then I'll make notes in there. The one week I forgot my CPT book is when I was all out of whack, chapter 15.
Yeah. Okay. And then just make a note, you know, along the side there, services reported separately. So what do we use anesthesia for? We use it to relieve pain, and we use it to manage unconscious patients, to manage life functions, and resuscitation. That part is not too important for the national exam. That's just information to keep tucked away in your brain, okay? What do we use anesthesia for? So if you wanted to make a note in here, you know, down at the bottom of the page somewhere, you could say, you know, relieves pain, manage unconscious patients, life functions, and resuscitation. But it's not on the national exam, so it's not something I would say you really need to know, all right? What are some of the methods? Okay, well, some of the methods of anesthesia to start off with would be endotracheal. So, we will get back to where I tell you to highlight and underline, all right? So for right now, we're good. Endotracheal means through the mouth. Then we have local, which is application to the area. And then we have epidural, which is into the epidural space. And then regional, which is a field or a nerve. So if you want to write these down over on that blank space on page 53, I'll repeat them. Methods of anesthesia. The first one is endotracheal, which is through the mouth. The second one is local, which is an injection or topical application to the area. The third one is epidural, into the epidural space. And then the fourth one, regional, which is the field or the nerve. It includes a spinal and an epidural.
Could you repeat that last one?
It would be regional, and it's field or nerve. It would include spinal and epidural. And then the last one would be patient-controlled analgesia, PCA. This is where the patient administers the drug. This is where it's most often used to control some acute post-op or chronic pain. I think I'd want to just be sleeping the whole time. Now, moderate conscious sedation. It's going to be the fourth paragraph in your guidelines. Just put brackets around this or highlight it, put a red asterisk next to it. This would be on page 52 in your guidelines. The fourth paragraph, it talks about moderate conscious sedation. Moderate conscious sedation is where the patient controls his or her airway and they can respond to verbal commands. So generally it will render the patient unconscious. They have a decreased level of consciousness, and you would report these codes with 99143 through 99150, which comes from the medicine section. Your codes are going to be divided on age, greater than or less than 5, time, and who performed the service. So I would say to you to really read these guidelines before you complete your homework from here on out. After class, after class, we've highlighted and underlined, read the guidelines before you complete the homework. Or read the guidelines before you complete the homework. Then when you come to class, we'll talk about them again. Because you probably understood them one way when you read them to do the homework. And then when we come to class, we might clarify some questions that you have. So the anesthesia section format, if you look at figure 16-4 in your textbook, you're going to find that it's based on anatomic divisions. So the anatomic site is the upper leg. The type would be hip joint or integumentary system. Now turn to the next page in your textbook, 494. We're still in the guidelines. Go down to the last paragraph in the left-hand column in the guidelines. To report regional or general anesthesia provided by a physician also performing the services for which the anesthesia is being provided, see modifier 47 in Appendix A. So you want to find out what page that is in Appendix A and write down there in parentheses what page that is. And this changes every year from class to class because the books change. So you're going to have to look in Appendix A and find out where modifier 47 is. So what page is it?
679.
So see page 679. And you can also refer to your HCPC book for modifiers if you wanted to as well. If you didn't remember where they were in your CPT book, you could also write down the page they are in your HCPC book.
Have you heard anything on those yet?
No, they are still delayed. The email last week was, we're sorry for the delay. We had such an abundance of orders. We're doing our best to fill them all. I still don't have mine. Over in the right-hand column, underneath time reporting, the second sentence all the way to the end of that paragraph. Your anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room or in an equivalent area, and ends when the anesthesiologist is no longer in personal attendance. That is, when the patient may be safely placed under postoperative supervision. So if you're in your surgery waiting area and the anesthesiologist comes in and starts talking to you, guess what? That is when that anesthesiologist's time starts. And it ends when you have completed your surgery and are back out in the post-operative area and starting to wake up. That is when your anesthesia time ends.
So don't
from
jib or
beginning to end. Okay? So your anesthesia formula is how we get paid. It is the base plus the time plus the modifying units. Now, I'll tell you right now that we're learning this so that you can figure it out if you have to, but the anesthesiologist usually figures it out. They tell you what all of these are. The B is the base unit. It is published in the RVG, which is also known as your relative value guide. It is actually published by the ASA, which is the American Society of Anesthesiologists. There are national unit values for anesthesia services. They are based on complexity, as well as the base unit value. Their guides list all of the CPT anesthesia codes, and usually they are have italicized comments that are added to the ASA's RVG. if you look on page 497, you'll see a base unit value assigned to each code. Your anesthesia services are paid on a set amount per unit, which is the conversion factor. So, for example, if a Medicare unit value in North Carolina in 2013 was 2109, and then we have time, the patient record indicates the time was 15, 30, or 60 minutes. It's usually often in 15-minute increments. So 1 unit is 15 minutes, 60 minutes is 4 units. So our time begins when the anesthesiologist begins to prep the person, continues throughout the procedure, which is your intra-op. It ends when the patient is no longer under that anesthesiologist's care. So if the anesthesiologist started at 9 a.m. and the patient is discharged to the PACU at 1:30, it would be 270 minutes. The PACU is your post-anesthesia care unit. And we have M. M is our modifying unit. This is the physical condition that's indicated by the physical status modifier that you see there on page 53 in your guidelines. You have P1 through P6. They have risk factors, and it's not usually reported for Medicare. So your physical status modifiers are usually on the exam. You see there P1 is a normal healthy person. So pay attention to these when you're doing your examples, your exercises. P2 is a mild systemic disease. P3, severe systemic. P4, severe systemic and in constant threat to life. P5, not expected to survive without operation. And P6, the person is brain dead. Payment differential is based on some physical status ratings, so you would have to know what those are ahead of time. Again, everything is going to be documented. If it's not, you're going to query someone, more often the provider. Some other modifying units would be qualifying circumstances over on the right-hand column on page 53 in your guidelines. Your qualifying circumstances are 4 add-on codes that you see right there, and they are add-on codes. So the last sentence of that paragraph up above, these procedures would not be reported alone. Highlight that. These qualifying circumstances are in these guidelines. They are also in the medicine section, and these are not reported to Medicare. On page 501, you'll see the example of the qualifying circumstances. These would be listed in addition to the primary anesthesia code. Again, in addition to. They are not standalone codes. They are add-on codes. So to summarize the formula, we would have our base units, which come from our relative value guide. These are based on the CPT codes. Your time units, your modifiers. Your modifiers are your qualifying circumstances and your physical status modifiers. So B plus T plus M equals total units times the conversion factor, whatever that conversion factor is, equals the payment. So if you turn to page 503 in your textbook, you'll see these are 2013 conversion factors. So in Manhattan, New York, the conversion factor is 2403. So if we had 2 base units times 270 minutes, we would have to figure out how many time units that is, times the modifiers, or plus, sorry. We would take that total, multiply it by our 2403, and that would give us what our payment should be for that particular service. Again, we're giving all of this information. We would know where to find the conversion factor. But that's also why we have electronic health records and billing systems. So all that stuff is already in there. Sorry, but it's good to know how to get to it, right? Your anesthesia for multiple surgical procedures. Once the person is anesthetized, the length of time is not for the number of procedures. So if we have 2 procedures during the same session, let's say one is a 10 base unit value and the other is a 5 base unit value. We're only going to report the 10 base unit value. Why? Because that is the one that takes more of the time. Okay? Your HCPC modifiers. So make a note to yourself, a sticky or something, just an extra scrap of paper, because you want to remember to find these in your HCPC book when the HCPC book comes in. So make yourself a note to find your HCPC modifiers that may be added to anesthesia codes. So on page 52 in your guidelines, let's go over some of the highlighting. For anesthesia services, underneath that heading, anesthesia services, in the second column on page 52. Last sentence, special services and reporting are listed in the medicine section. Supplied materials, the last line, with 99070 or the appropriate supply code. Highlight that. Separate or multiple procedures. The first 4 words, when multiple surgical procedures. In the third line, highlight the most complex procedure is reported. And then the last line, combined total for all procedures. Underneath special report, a service that is rarely provided, unusual, variable, or new may require a special report. Turn to page 54 in your CPT book. right next to anesthesia in parentheses, I want you to write anatomic site. What do I mean by that? I mean that anesthesia is divided or separated by anatomic site. Okay, on code 00120. This is also known as a tympanotomy. Sorry, tympanostomy. 00120 is also known as a tympanostomy. And 00126, next to that you can write in parentheses myringotomy. This is where your terminology is coming in. 00126.
What was it? Sorry.
Myringotomy. M-Y-R-I-N-G-O-T-O-M-Y. On page 56, over on the right-hand column, I believe it is 00836. You have two parenthetical notes, one above and one below. Do not report 00834 in conjunction with 99100. Highlight it.
Can you say that again?
Highlight it.
Highlight what again?
The parenthetical note above and below 00836.
00836.
Okay, and right next to 00836, you might want to put a little bracket and put a note that says watch for age on the codes. Because if you notice on 00836, it tells you infants younger than 37 weeks gestational age at birth and younger than 50 weeks gestational age at the time of surgery. So you might actually go through these codes and highlight just the age. So you know what the age is so that it sticks out to you right away. I'm going to turn the camera for a minute so I can show you what I mean by bubbling. So this is a little tip. All right, you're going to have to let me know if you can see it all right. So in your books, you have we'll just take we'll take the underneath the lower abdomen. Okay, we'll start there. Now, you're going to notice that these codes are not indented, but the wording is. Okay? So when I talk about bubbling, what we're doing, and you can choose to do this or not, you don't have to. But if you're not going to do this, I suggest you go through and highlight the certain key terms that I talk about. All right? This might be a little bit more work, but if you're doing it as you're doing your homework, it's going to save you some time. What you're doing by this is, this ends up being the parent code, okay? And this is like the assistant, okay? So what you're doing is you're bubbling these two codes so that you know they go together. All right, you're going to see the same thing down below with 00830 and 00832. Okay, again, they're not indented. The second one is 00830. And 00832 is indented, but you're going to bubble it because then that's going to tell you those two go together. And then for 00800, what I would highlight there would be lower anterior abdominal wall, and then 00802, you know it's just a panucolectomy. Well, if you don't know what a panucolectomy is, I suggest you Google it and you come back here in your book and you write a key term that tells you what that means. We know it's an ectomy. What's an ectomy? Something being removed, right? What's being removed?
Pancreas?
Panucolectomy. Sounds like it, okay? But Google it, okay? So, again, this is a suggestion. It's not, Doreen said so. It's a suggestion. Because if you're not doing this, I suggest that you're going to be highlighting and underlining, okay? So like I said earlier, you know, watch your age on the codes. Well, if you look at 00832 in the parenthetical note, it says for hernia repairs in an infant 1 year of age or younger. Guess what? I'm going to highlight infant 1 year of age or younger. And the codes later on, if there's an age, I'm going to highlight it. If we look down at 00840 through 00851, guess what? I would put a big bubble around those because those all go together. Because 00840 is the parent code, the major code, and everything after it applies to it. So it is anesthesia for intraperitoneal procedures in the lower abdomen, including laparoscopy. Well, guess what? It's also, if it's not 00840, it is amniocentesis, abdominal perineal resection. All of these relate to 00840. Is everyone following me so far? Lisa Leonard?
Can you hear me?
Yes.
Okay. Does that mean that we would do 00840 is a standalone code, and then 844 has to be coded with 840?
No. And we'll
Okay.
get into that later on. okay?
I'm ahead of it.
Yes, you are, but that's fine. It just means that you have an option of 00840 or 00844. It's a matter of what's the exercise asking you and which one is more appropriate. Which one meets that level of specificity that we're looking for in the documentation. So the 00840 might actually be just fine. But if they told us in the exercise or in the documentation that it was an abdominoperineal resection, we're going to choose the 00844 because we were told it was an abdominoperineal resection. Okay? It just means that they used anesthesia for abdominoperineal resection in the lower abdomen, including laparoscopy.
Okay.
We're taking out intraperitoneal, or we're taking out lower abdomen and putting in the other word.
Thank you.
Okay? You're welcome. Lisa Fry, following?
Sorry, I had my thing off because I moved pages around. Yes, I am.
Okay. Make sense?
Yep.
Good. Okay, so that's going to be the only time I'm going to show you about bubbling, because if I show you about every section in the book, we'll be here forever. But it kind of gives you the idea of what I'm talking about. So take the parent code and any codes that follow underneath it, and it can just be a simple pencil bubble. It doesn't have to be anything huge, but just something to draw your attention to the fact that all these codes go together. You can just even put a bracket, on each side. However you want to do it. But as we get into the codes in the book, where you're going to want to start highlighting anatomic sites, and because I want it, it's not coming off. As we get into it, the words will come back. But right now we're in age, so that's a big thing. Is it lumbar? Is it cervical? Is it transabdominal? So as we hit them, I'll remember them. But I wanted to point that out. How about we do class like this? Okay. All right. Okay. Over on page 57. Underneath perineum, on code 00910. Let's read that for just a minute. Anesthesia for transurethral procedures, including ureterocytoscopy, not otherwise specified. What does that sound like to you?
Checking out the cysts in the urethra?
Yep, it sounds like a lot of work. So we're going to write beside that labor intensive. That is labor intensive. And guess what? We can bubble all the codes with it down to 00918. Because we know all of those codes are going to go together. Over on page 58. Okay, good. We're getting into some of the code words. All right. Right hand side, lower leg. 01462 is closed procedure. Highlight closed procedure. 01464. Highlight arthroscopic procedure. And 01480, highlight open procedure. Okay, so then you're going to highlight throughout the types of procedures. Is it open? Is it closed? Is it arthroscopic? And then, as I mentioned earlier, the type of anatomy. So is it knee? Is it ankle? Over on the left-hand side, underneath knee and popliteal. Yes, the heading says knee and popliteal, but if you highlight it in the descriptor, you won't have to look for it. Turn to page 60 in your CPT book. Underneath burn, excisions, or debridement. You want to watch for add-on codes here, so make a note to watch for add-on codes. And then on these three codes, I would highlight the percentage of body area on each one. So the percentages, highlight those. And then underneath the obstetric section, highlight the type of delivery, vaginal, cesarean, the type of hysterectomy, the next one would be incomplete or missed abortion procedures, induced abortion procedures. Okay, does that help? All right, let's do 16, review and practical in your textbook. All right, review and practical, or theory and practical, page 508 in your textbook. Number 1, what do you have, Lisa Leonard?
I put down actual time.
It would be total time.
Close.
Close. Yep. Number 2, Lisa Fry.
It's from the time the anesthesiologist sees you, meets you, goes over it, to the part of where he's in the middle of it, till he's done with you completely. And you're
Very
put
good.
into the nurse's station.
Very good. 3, Emily.
47.
Modifier 47. 4 is physical status. 5 is moribund. Moribund. 6 is systemic. Number 7 is 6. Number 8, Lisa Leonard.
Qualifying circumstance code.
Yes. 9, Lisa Fry.
I didn't get number 9.
Anatomic.
Thank you.
And 10, Emily.
By the most complex and the total time.
Complex and combined total or total time.
So total time's 5 minutes.
Yep. 11 is no. And 12 is relative value guide, RVG. All right, for 13, 01610 with a P1 modifier. What do you have for 14, Emily?
01967 with a P1 modifier and 01969 P1 modifier.
So that was 01967 with a P1 modifier and 01969 with a P1 modifier. 15, Lisa Leonard.
01965 with a P5 modifier.
That's correct. 16, Lisa Fry.
00215 with a P2 modifier.
That is correct. 17, 01214 with a P2 and a qualifying circumstance of 99100. So did this chapter seem a little better than the E&M codes?
Yes.
Yes. Yes.
18, 01952 with a P1 and a 99100. What do you have for 19, Lisa Leonard?
99222. I didn't get a P code though.
Say that again.
I didn't get a modifier on that.
For number 19?
Yeah, I have a question mark there.
Yeah,
Okay, it's 01996 times 5.
Okay.
So look them up and tell me why you got what you got. What were you thinking, Emily, when you got it?
I had the 01996 times 5.
Okay,
But my only, so times 5 should be even. Well, it's separate. I just had it all jumbled together.
That's fine.
Times 5.
I just want to look at what a 99222 is.
yep, that's fine.
Where's this there? So far, I have no idea where I got that number.
Maybe it was late and the kids were being a pain.
I usually do it between 9 and 12 at night, so yeah,
It was late.
always late.
Okay, so we'll chalk it up to that.
Okay.
Number 20, you should have 01832 with a P1 modifier. Okay? Yes, no, maybe?
I got that one.
All right, let's go to our workbook. Page 97. Number 1, moderate sedation or conscious sedation. Number 2, certified registered nurse anesthetist. 3, basic unit. 4, modifying. 5, preoperative services. 6, postoperative services. 7, conversion. And 8 is QX, and if you didn't get it, that's fine because you didn't have your HICPIC book. Number 9, you should have P4. Number 10, P1. 11, P3. And 12, P6. 13, P2. 14, P5. 15, 01382. 16, 00846. 17, 00144. 18, 01961. 19, 00124. 20, 00914. 21, 01920 with a P2. 22, 00120 with a P1. 23, your diagnosis, 56213. 24, 41404. 25, 24201. And 26, 424.0 with 909.5. On your reports, for number 27, you should have 00400. 28, 00670. 29, 00140. And 30, 00930. How'd everyone do on those? Feel pretty good? As you can see, the chapter 17 is going to be an easy one. So let's take a quick break right here, okay?
so upset. You're missing this episode of Grey's Anatomy. Oh man,
Bailey went into labor. Yeah, but then her husband later got in a car accident, and so he's in the OR with Dr. Shepherd. While Bailey's face is like 9 centimeters dilated. But there's a cold black because some guy shot himself with a bazooka and he didn't explode yet. Bomb squad's in there, and Meredith has her hand stuck in this guy's chest, but the bazooka was exploding. What? He's operating. They evacuated the ORs, and he refused to leave because he's not letting doctors really touch his guy. They're operating his brain.
she don't know what's down there.
She refuses to give birth to baby.
What?
She refuses to give birth to the baby.
I believe it.
So I'm gonna watch the next episode and do this. I have to see what happens with the hand stuck in this guy's chest.
I just put it on my back.
Mom, do you know what movie we saw? I'm gonna see.
Well, how about you take it during lunch while I'm around?
I have to do the dishes.
Okay. I like crackers. Go on her bed.
All right. We all back?
Yep. Move it.
All right. So surgery guidelines and general surgery. Page 510 in your textbook. Page 62 in the surgery guidelines for the CPT book. All right, so your surgery section happens to be the largest CPT section in the book, if you haven't noticed that already. And the section format begins at 10021 and ends with 69990. Now, it is divided by subspecialty. So pay attention at the top of the CPT pages, and it will say to you, surgery/general, surgery/musculoskeletal, surgery/cardiovascular. So you know you're always in the surgery section, but what system or what subspecialty? Okay? So we start off with integumentary and go right up through to cardiology or cardiovascular. You will see that there are a lot of notes and guidelines throughout the sections. So when I said before, during, and after, read them. I'm not kidding. There is information that is varied and extensive, and when I say must read, it's a must read. It's like when your kids sit down with you at night and they want a bedtime story. Well, this happens to be your bedtime story. You must read these. So when you're reporting more than one procedure, you will see that your CPT has text changes. And what indicates to you that there are text changes? Those two facing triangles. That tells you that there is new or revised text. So that is definitely something I would look for, pay attention to in your CPT book. You also have a legend at the bottom of your CPT pages. Pay attention to that as well. If you see something in the body of the CPT book, look down below. Is there a key that tells me what that means? Your subsection notes on page 512 in your textbook, they give you figure 17-2. Your subsection notes apply to the entire subsection. So they give you in your textbook musculoskeletal system. That's the subsection. And they give you notes underneath it. Those notes will apply to the entire section of musculoskeletal system. So be aware and read those notes when you start that subsection. And then we have subheading notes. And your subheading notes apply to that entire subheading. So you'll see figure 17-3, spine, vertebral column, that is your subheading. And then there's a note underneath it. That would apply to your entire subheading. And then we have category notes. And your category notes apply to the entire category. Like you see on page 513. So the category is graphs. Graphs for implants. Then we have the note. And we have subcategory notes. So remember I told you before, at the top of the CPT page, it will say surgery. And then slash whatever section. So integumentary, digestive, genitourinary, nervous system. That is your subsection. Then we have our subheading. Then we have category. Then we have subcategory. And we have our notes. And your subcategory notes will apply to the entire subcategory. So they give you a good example right there, our 17-5 on page 513. There's some additional helpful information in the parenthetical sections. So as I mentioned to you earlier, to highlight those two parenthetical notes before and after, I think it was 00836. Pay attention to the parenthetical information, because that's where you're going to get the information that says to also code this, to see this, or do not use with this. Pay attention. Your unlisted procedure codes. On page 514 in your textbook. And we'll go back to the CPT and go over highlighting and stuff afterwards, okay? With the unlisted procedure codes, these are used only when more specific Category 1 or Category 3 codes are not found. all right? And a written report will accompany that submission. So whenever you hear unlisted procedure code, that should put off a red flag that says, hey, I need a note. Each of your unlisted code services are paid on a case-by-case basis. Your separate procedures are separate procedures following a code descriptor. It will say, use separate procedure code. These are usually incidental to or a more major related procedure. When I get remits or explanation of benefits from insurance companies that say they denied this procedure code because it was incidental to a more major related procedure, I just want to reach over through the phone and strangle them, because it's not. It was a distinct and separate procedure, and it should have been covered. It was not part of. So some of the things that might be incidental to a more major related procedure might be something like a breast biopsy. So before radical mastectomy, during the same operative session, this would not be coded. It's only as a procedure performed. If it was the only procedure performed, then you would code it. But if it's being done before radical mastectomy, it's not going to be coded. Understand? Okay. A separate procedure would be reported when only the procedure is performed. If it's with another procedure, it must be on a different site and unrelated to a major procedure. So if I have a chiropractor who is adjusting the low back and happens to do an extremity adjustment on the arm, I need to put the 98940 for the low back and show 98943 with a 59 modifier and the diagnosis codes for that shoulder or arm. Make sense? Okay. Your minor procedures are often on a service-by-service basis. They often do not have bundle of services. Your third-party payer deductibles usually show what is in a surgical bundle. And the minor procedure for Medicare has 0 to 10 global day period. So someone goes in for a simple, let's say it's done in an office. It's a minor procedure. 10-day global period's all they get. Your third-party payers will decide what is in a surgical bundle. So if you're coding surgeries, you better heck know what's in that surgical package. Page 517 in your textbook. Medicare has the correct coding initiative edits. They specify what is in the bundle. Okay? Major guideline of surgical packages. Your major surgical procedures usually include the preoperative, which is your before, your intraoperative, which is the during, and your postoperative, which is after, also known as the global period. And then any minor complications, okay? It's usually one bundle, one price. And your minor procedures may have no bundle. It's going to vary on the payer. Some major guideline examples. Most of your payers will specify 90 days after a major surgery. All of the services are related to the surgery are usually in the package. This would include the pre, intra, and post-op. If you do separate reporting, that means you are unbundling. What is never in a bundle would be your general anesthesia services. Why? Because as we learned in chapter 16, your anesthesia services are reported separately, right? Because they are independent. Your surgical package. If there's a minor procedure, it's going to be the pre-op and the post-op. And sometimes these are reported separately. I say sometimes. If it's the same day, they may be included in the performance of the actual procedure. And they can be reported separately if it is specified by the payer. Okay? Let's give a minor surgery example. A needle biopsy in an office. What are we going to report? We're going to report the biopsy, which is the procedure, and then the supplies, which might be the surgical tray. Now, do you get paid for that surgical tray? Not really, but you have to report it. You need to show what you did in that minor surgery. The surgical tray might consist of needles, suture materials, wipes, and drugs. How would you report these? You can use one of two ways. 99070, which is in your medicine section. Medicare usually bundles these things into the procedure. Or A4550, which is the HCPCS code. It's not usually separately reported to Medicare at all. When you are reporting surgery for an outpatient coder, it is the physician payment, the professional. As an inpatient coder, it is the hospital payment, the facility payment. Underneath your general subsection, and I mean it's general, it's not that long. It starts with 10021 on page 67 in your CPT book. Take a look. 11021 and 10022. See right there, it says surgery general. Right up at the top on the right hand side, it says surgery general. That's what I meant earlier when it separates it by, you're in the surgery section, but then what system are you in? Okay? Under the general surgery, you're going to find fine needle aspirations with or without imaging guidance. Right there in those two codes I gave you, 10021 and 10022. One is with and one was without. I would highlight those two, without and with. But don't you have some parenthetical notes in there? What do they say? For placement of a percutaneous localization device, they tell you to use certain codes. For radiology, supervision, and interpretation, they tell you to use certain codes. For a percutaneous needle biopsy, they tell you what to do. For evaluation of the fine needle aspirate, see? So you don't just stop looking at code 10021 and 10022. You continue reading the whole thing. Okay? So let's go back to page 62 in our CPT book and start with some highlighting. We finished the chapter. See, it was quick. It gives you a brief introduction to surgery. And we'll go over the highlighting I want you to just look at, pay attention to. Again, you know, whether or not you highlight your book is completely up to you. Whether or not you tab it is completely up to you. I strongly suggest it because it makes a huge world of difference. And I haven't had one student yet that has said, oh my gosh, what a waste of time. Because they can't imagine ever taking that exam without tabbing and highlighting. They look around them and they've said to me, I don't know how they did it. For people who did not highlight or tab. All right, so on page 62, right there underneath services, evaluation and management services section, 99201 through 99499. That's what I would highlight in that first paragraph. The last sentence, under services, special services and reports, 99000 through 99091 are listed in the medicine section. Put a nice red asterisk next to CPT surgical package definition. And in that paragraph, the very first sentence, by their very nature, the services to any patient are variable. The third sentence of that paragraph, in defining the specific services included in a given CPT surgical code, the following services related to the surgery when furnished by the physician or other qualified healthcare professional who performs the surgery are included in addition to the operation per se. And then underneath it lists the 6 areas. And right over to the left of E&M, I would put modifier 57 because that is subsequent to the decision for surgery. And you would put a modifier 57 with the E&M code. Underneath typical post-operative, I want you to make a note to use 99024. For follow-up care for diagnostic procedures, highlight that first sentence in that paragraph. Over in the next column underneath follow-up care for therapeutic surgical procedures, highlight the first sentence in that paragraph. Underneath supplied materials, the last sentence, identify as 99070 or specific supply code, and what I want you to write off after that is A4550. Under reporting more than one procedure in service, just highlight that whole paragraph. And circle CPT modifiers may apply. Underneath the separate procedure, the second sentence that starts in the first paragraph, the codes designated as separate procedure should not be reported in addition to the code for the total procedure or service of which it is considered an integral component. Over on page 63, underneath unlisted service or procedure, highlight special report. And you'll see there's a whole list of unlisted services or procedures. They end with a 9. That's usually a big indicator. You need a special report. Over on page 64, in your CPT book, underneath special report, highlight that first line. A service that is rarely provided, unusual, variable, or new may require a special report. Now, as we start getting into the different sections, you'll notice that there are anatomical illustrations. I want you to pay attention to those and the blank spaces, because this is where, if you need to refer back to those anatomical illustrations, make a note where they are or tab them. You know, put a tab that says anatomy or whatever you need to refer, you know, to keep your memory fresh, that's where you're going to see, you know, like the picture they have here on page 65, okay? So this is all about the skin, right? Okay, so you might want to say, put a tab skin, I don't know, whatever you need. Turn to page 67. We already started with code 10021 without imaging procedure. 10022 with imaging guidance. Now, as you notice, all of these subheadings talk about the type of procedure. So underneath integumentary system, we have introduction and removal. Over on incision and drainage, these are the types of procedures being done, okay? So 10040 is what? It's an acne surgery. Highlight that. 10060 is an abscess. What type? Simple or single. 10061 is complicated or multiple. 10080 is simple. 10081, complicated. 10120, simple. 10121, complicated. Okay, if we look at 10080, what is it as simple drainage of? A pilonidal cyst. 10120, it's a removal of a foreign body. So whatever's going to stick out for you, highlight, underline, because you want to know what it is. You don't want to have to be reading all of this. So underneath the 10081, in a parenthetical note, it tells you for excision of pilonidal cyst, C 11770 through 11772. Again, paying attention to those parenthetical notes. Continue the reading. 10160 is a puncture aspiration. 10180, complex. What does that mean? It means that it's over and above the first service. So I want you to write that, over and above. Page 68, on code 11000, the percentage of body surface. Highlight that. The add-on code 11001, each additional 10%. 11004, debridement. Debridement, external genitalia and perineum. So pay attention to the location in the body part in these. So if you can keep in mind, the more extensive the layer, the higher the code. So maybe down below, the higher the layer, the more extensive the layer, the higher the code. Code 11008, highlight prosthetic material or mesh. Foreign material at the site of an open fracture. This might be in relation to some kind of an accident. So, note to yourself, accident related. Over on page 69, 11042, debridement, subcutaneous tissue, first 20 square centimeters or less. 11045, each additional 20 square centimeters. 11043, debridement, muscle and or fascia, first 20 square centimeters or less. 11046, each additional 20 square centimeters. 11044, debridement, bone, first 20 square centimeters or less. Paring and cutting over on the right-hand column, you will see this on the exam. 11055 is for a corn or a callus, usually a single lesion. 11056 is the 2 to 4 lesions. And 11057, more than 4 lesions. Your biopsy, usually, sometimes they can do this in a family practice, depends on the type of biopsy. 11100, biopsy of skin, includes simple closure, single lesion. 11101, each separate and additional lesion. Down at the bottom, removal of skin tags, make yourself a note, no modifier 51. Page 70. Code 11200, up to and including 15 lesions. (11201), each additional 10 lesions. Okay, down underneath, shaving of epidermal or dermal lesions. Highlight that first sentence. Shaving is the sharp removal by transverse incision or horizontal slicing to remove epidermal and dermal lesions without a full thickness dermal excision. 11300, single lesion, trunk, arms, or legs. You might want to put yourself a note right at the very top. The bigger the size, the more the work. Because if you look at each of those codes, they start 0.5 centimeters or less, and they go all the way up to over 2.0 centimeters. So in those codes, you want to know what the size is. What's the site and what's the size? So this is where that bubble would come in handy that we talked about earlier. So the next set of codes, 11305, single lesion, scalp, neck, hands, feet, and genitalia. Then the next set of codes, 11310, single lesion, face, ears, eyelids, nose, lips, mucous membrane. Underneath excision section, the second paragraph, that first sentence, excision is defined as full thickness. Highlight that first sentence. And let's go back to the top paragraph in the third line where it says includes local anesthesia. So when they're excising these lesions, benign lesions, the anesthesia is included. You would not separately code anesthesia. Over on page 71, left-hand column, very last, at the end, the first sentence, the closure of defects created by incision, excision, or trauma may require intermediate or complex closure. And then over in the right-hand column, starting with code 11400, you basically want to go down through all those codes, highlight the anatomic site and the size of the lesions. So those stick out for you. So this becomes two big bubbles on that page. 11400 through 11406 is the first bubble. Over on page 72, same thing in that left-hand column. What's the anatomic site? What are the size of the lesions? And then as you get down to the bottom of the left-hand column, what type of repair? Is it simple? Is it intermediate? Is it complex? Again, read your notes before each heading. Over on page 73, the same thing. What's the site? What are the size of the lesions? Okay? Over on page 74, next to nails, I want you to write no modifier 51. And this is where you want to know, what are they doing? Are they trimming? Is it debridement? Is it avulsion, evacuation, excision, biopsy, repair, reconstruction, wedge excision? That whole left-hand column, those are the types of things I would point out. Underneath the pilonidal cyst, is it simple, extensive, or complicated? Underneath introduction, injection, including 7 lesions. Next code, more than 7 lesions. On code 11920, tattooing, and then the size. 11950, injection of filling material. 11960, insertion of tissue expanders. 11970, replacement. 11971, removal. And again, with each of these codes, if there's a size of a lesion, also highlight those sizes. If you look at repair closure, that gives you some more reading to do on simple repair, intermediate repair, complex repair. If you go over to page 76, your repair simple, again, what's the anatomy and what's the size? What are the centimeters? Same thing under intermediate, under complex. Again, highlight your anatomies, highlight the centimeters. On code 12020, that would be simple. And again, any word you do not know, look it up and write yourself something in here to help you remember it. On page 78, top of the left-hand column, skin graft necessary to close secondary defect is considered an additional procedure. Highlight that. You have a page of notes to read on page 79. On page 80, surgical preparation, recipient site. Percentage of body area. Anatomy, what area? Is it an autograft, a pinch graft, a split thickness graft, or an epidermal autograft? Over on page 85, underneath burns, the percentage of the body area. On page 87, destruction. What does destruction mean? Destruction means the ablation. Highlight that whole paragraph. It's a small one, page 87, underneath destruction. What does destruction mean? On page 88, underneath destruction, malignant lesions, any method. Again, What's the anatomy and the size of the lesions? Underneath Mohs micrographic surgery, highlight that first sentence. And then again in the codes that follow, what's the anatomy and how many blocks, how many tissue blocks? On page 89, underneath other procedures, you only have 4 listed there, but they're 4 different procedures. I would just highlight the first word. Underneath breast and incision, you have puncture aspiration, mastotomy with exploration, injection procedure. Over on excision, highlight that first line that says, excisional breast surgery includes certain biopsy procedures. And in the 4th line near the end, highlight biopsy procedures may be percutaneous or open. And then read on to understand more about excision biopsies for the breasts and stuff. Over on page 90, you want to know, is it percutaneous, open, and incisional? On page 91, underneath mastectomy procedures, you want to know, is it partial, simple, or radical? And that carries over to page 92. And that takes care of highlighting and underlining for that section. So, Emily, how does that feel for you? Does that feel good?
Yeah.
Okay, so instead of doing this every class, with your homework moving forward,
Just do this.
just do that type of stuff. Okay. Feel okay?
Yeah.
How about you, Lisa Leonard? Can't hear you.
The lights were on. Can you hear me now?
Yes, I can.
I said I'm feeling a little jumbled, but I get it. I think I get it.
Okay.
Yeah.
Now, obviously, do what you can through the next week on your homework and stuff for the next 2 chapters. And I will go over some of the highlighting and underlining that I want to point out to you. So it's not like you have to go crazy, okay? But just if you can pick out those key words and bubble it if you want to bubble it so you know, or even if you just bubble the big ones. However you want to do that, okay? You'll see that what I just mentioned to you, those are the things I look for in those codes. So the anatomic site, and then what type of procedure is it? You know, something that's going to jump out at me. Okay? And then when we get into musculoskeletal next week, we'll talk about more of that. But again, basically, whatever can jump out at you, that's what you want. So when you're looking at these codes on the national exam, and again, to remind you, the national exam is a multiple choice exam. So just because you might not get it in your homework, doesn't mean you're not going to get it for the exam. Okay? So let's do Chapter 17, Theory and Practical. In your textbook, page 522. Number 1, surgery. Number 2, no. 3, medical specialty or body system or anatomical site. 4, guidelines. 5 are those 2 triangles that face each other. 6, parenthetical. 7, unlisted. 8, special. 9, separate. 10, surgical. 11, local. 12, minor or similar word. 13, 99070. 14, A4550. And 15, 99024. 16, surgical. 17, concomitant. 18, local. 19, 69990. 20, surgical service. 21, 76942. 77002. 77012 and 77021. 22, 88172, 88173, and 88177. Okay? Let's go to the workbook. What do you have for number 1, Lisa Leonard?
I just did the evens.
That's fine. So tell me what you have for number 2.
Notes, guidelines.
Guidelines. So 1 is female genital. 2 is guidelines. So I'll do the odds, you guys do the evens. 3 is categories. Emily, 4. Followed. Right? Yes, you have to speak up. And 5 is unlisted. 6, Lisa Fry.
Special.
Yes, special. 7 is major. 8, Lisa Leonard.
No.
Correct. No. Only the mastectomy. 9 is yes. 10, Lisa Fry.
I don't have it.
Guess.
I stopped. I didn't get anything done after 11.
Okay, guess.
I don't know.
Follow up.
Oh,
Follow
yes.
up. 11
Thinking
is
too
local.
hard.
12, Emily.
Exasperation.
Exacerbation. 13 is general. 14, Lisa Leonard.
Global.
Yes, global or post-operative. 15 is 99070. 16, Emily.
A4550.
A4550. 17 is same. 18, Lisa Leonard.
B.
A. 19 is dehiscence. 20 is
True.
20 is false.
Oh, sorry.
It's okay, don't be sorry. All right, 21. 11021 through 69990. 22, Lisa Leonard.
Urinary.
Yes. 23 is operating. 24, Emily.
Imaging guidance.
Yes, imaging guidance. image guidance or imaging guidance. 25-42400. 26, Lisa Leonard.
Therapeutic surgical procedure.
26 is separate procedure.
Okay.
27 is therapeutic. 28, Emily.
59000 through 59899.
Yes. 29, 40799. And 30, Lisa Leonard.
53899.
Correct. All right. Let's take a look at the homework for next week. I believe it's 2 chapters now. There's nothing in the workbook for 19 that sticks out as far as bothering me for you guys. So it's actually 18 and 19. So integumentary and musculoskeletal. Again, remember that you are only coding in the system you are working in, unless it specifies otherwise. So for integumentary, let's take a look at report 40, for number 47, report 7 in the back of the book. On page 213. So we have a preoperative diagnosis and a postoperative diagnosis. Lipoma, left posterior axillary fold. Okay. What did they do? They removed a 6 centimeter diameter attached to the latissimus dorsi muscle. Where's your latissimus dorsi muscle?
Dorsi is furthest away.
Dorsal means back.
Yeah. Thoracic, thorax. Okay, so we are doing what? We are excising a tumor from the thorax. Pretty simple. And then obviously you've got a diagnosis code there. Okay? How about report number 9, page 214. We have a mass on the right breast mass excision. What are we doing? Excision of a breast lesion.
174.9.
Close but no cigar. You're not far off.
Okay.
Then 51 is report number 12, page 215. We have an ischial pressure ulcer with massive ischioperineal and buttock sinus. I want you to Google that. I am not kidding. Google it. Okay? And then you're gonna look it up.
It's probably pretty yucky.
It sounds yucky.
Yeah, that's what I'm
is.
thinking too.
Sounds right.
But do you know where it is?
It's in the nose.
No, it's in your butt.
It's in your butt.
Buttock, your sinus.
Your
It's
butt
in your
has
butt.
a sinus.
Ugh. So it's going to be blown out by the time this procedure's done and over.
There's an actual picture of the ischioperineal sinus. I want you to look it up. Okay. And then for 19, the musculoskeletal. Let's look at report number 10, page 214. Okay, neck injury, closed posterior cord syndrome caused by a fracture due to a motor vehicle accident. The procedure being performed is placement of a halo crown and vest. And then we've got 2 diagnosis codes here. The first one is actually going to be what?
95204.
Well, I don't want the number. I want to know what we're looking at. We're looking at a fracture.
X. Yeah.
And then the accident code. Okay? Okay. So it seems like these reports will be pretty good.
Mm-hmm.
Yeah, not too bad. Let's look at one more. Report 14 on page 216. Deltoid muscle pain and swelling, myocystitis. What's cystitis? Inflammation, right? Okay. So I want you to go ahead and look up number 14 for me right now. Myocystitis.
Sit up.
What do you have, Emily?
729.1.
What do you have, Lisa Leonard?
729.1.
Lisa Fry?
Yeah. Same thing.
Sounds like a plan. 729.1. Okay, and the next code is going to be a V code. Who can tell me why?
I must have known because I already have it.
What is it?
I just have to read down operating room ventilator patient.
Basically, because the patient was using a ventilator, so we have a status code, and that would be a V code.
The V4611.
Right.
Yeah, I remember I talked to you about this one. That's why.
Yep. All right. Lisa Leonard, any questions from tonight?
Not from tonight. No.
Okay. So if you want, we can do that video chat. That just send me some times.
It wouldn't be a video chat because my internet's still kind of screwy.
Okay. Well, we can do a phone call.
Okay.
Not a problem. Okay. So what is your takeaway from tonight?
A lot more work is going into the CPT book than the ICD-9.
for right now.
Right now, I'm scared of this book.
Yes. Lisa Fry.
I like the idea of your bubbling. I think that's going to help me a lot when I look at something and I know that's just one subject right there and I can just go down through it. And I think that's going to help me a lot.
Good. So how we went through the highlighting and stuff, was that helpful or not?
Helpful.
Okay. So if it doesn't work in the next class, then you need to say something. Okay? Because this is how I teach it all the time. And every class set of students is different. All right? The only thing I changed in this particular class is the bubbling. And that was only because I watched something and the person talked about this and I said, can't hurt. So whatever little tips and tricks, you know. And just, I'm going to start talking about the national exam now because people will say, you didn't say that. And I'll say, go back to the lecture because yes, I did. What's your takeaway?
I'm trying to be not as scared of the CPT book, and the bubbles really did help in the highlighting stuff, making it stand out to me more, because I get overwhelmed when I look at a blank page and
Right.
nothing's sticking out
Right.
right away.
Well, if you think about it, you're looking at this big page, 8.5 by 11 with all these numbers and all these words. Now, I don't know about you, but I have to use glasses now. So the fact that they're small to begin with, and then to make them stand out more, highlighting and underlining and bubbling are going to make it that much easier. And if you pay attention to the guidelines and read the notes in before and during and after, like we've talked about, that is going to save you so much time when you're coding. So, if you can think about that when you're doing your exercises this week, see how that helps you. Okay? See if it helps you. Because then you'll decide if you're going to continue to bubble, highlight, and underline. Honestly. All right? So the national exam. We're on week 13. So we're really just, 6-7 weeks shy of completing. All right? We have a school vacation coming up in February. I think it's February 16th. Right? So just a few weeks. National exam is 5 hours and 40 minutes. And we will continue to talk about it and go over it as time draws near. As I said in the very early portions of the class, I talked about it, how long it was, that it is multiple choice, that you can only bring the 3 books, the CPT, the HCPCS, and the ICD-9. You have to bring quiet snacks. It is multiple choice, and it really is all about time management. That's why we offer the pre, the post, and the mock exam. All right, that mock exam is usually a Saturday that I choose after we finish the class, and we come together, however many people want to come together and do a practice mock exam. So you really have 3 tries to simulate the national exam. And for those of you who are doing it online or at home, if you live in the local area and you want to come to the mock exam, you're more than welcome to. You just need to let me know where you're at with the class, and I'll be happy to have you come. Okay? The CPC exam review is not on your Evolve yet. I don't want you even looking at it yet. It will be put on there the same way the Buck book was and the same way the Fordney book was. When it's time, it will be on your Evolve. Okay? It is a timed test. You sit there for 5 hours and 40 minutes, and you sit just like you would the exam, and you take it on the computer. The mock exam would be taken live in a classroom setting wherever I can get space. You bring your exam review books. You use the bubble sheet just like you would for the national exam. I simulate it as much as possible like the national exam so that you get an idea and feel of it. By the end of this class, you will know the material. It is not a question of whether or not you know the material. It's knowing where to find it and time management. That's what it comes down to. So the more we can prepare your books now for the national exam, the better off you will be when it comes time for the exam. Because as I said early on, it is not about memorizing. There is no way in heck, not even I can memorize this, okay, or this. It's knowing where to find it. So the tabbing, the highlighting, and the underlining, that is what helps make it easier for you. Okay? Whatever will jump out at you. So as we get into the systems more, you'll see that every system starts repeating the type of setup, the format. Okay, so anatomic site, type of procedure, and then whatever else follows after that. But pay attention to the notes. Okay? After that, any questions? Lisa? Lisa?
No.
Okay. As we get closer, I will also send you all the exam application form because I usually like to have everyone sit within a month or so after we've wrapped everything up. Just because it's still fresh, okay? If you can't do it for whatever reason, that's not a problem. We just try to make sure everyone gets signed up as soon as possible. If for some reason you do not complete and take the exam in 2015, you will have to get new coding books to sit in 2016. Do I expect that to happen to any of you? No. I'm just letting all of you listening know that ahead of time. Okay? The billing and reimbursement portion of the class is not on the national exam. It is something we offer extra so that when you leave here, you have 2 certificates, not just one. Okay? All right. With that, do you mind if we finished a little early? Okay. Lisa Fry?
Have a good night.
Okay.
I'm going to go to bed. That's all I can say.
Okay.
Uh,
Have a great
Bye.
week, everyone. We'll see you next week. Thank you for your time.